All right, let's start. Hello, everyone, and welcome to today's webinar, Inclusion of Persons with Disabilities in the Humanitarian COVID-19 Response. This is the first webinar of the joint project Phase 2, Leave No One Behind, from HI, CBM, and the Ruhr-University of Bochum. And we are very excited to have so many participants with us from around the world today. Now, while more participants continue to join, as I see, I would like to use the time to introduce myself and run through the accessibility features and how to navigate in GoToWebinar for you. Next slide. My name is Hakon Sprieveld, and I'm the coordinator for the project Leave No One Behind. I'm based in Berlin and I've been working with Handicap International, also known as Humanitarian Inclusion, since 2017 now. My colleague Sabrina Ebert, whom you can see next to me, is the project officer of the project and also joins us from Berlin today. She will monitor the chat box of the webinar and later moderate the question and answer session too. And additionally, she can help you she can support you when you have technical difficulties during the session. Next slide. Let's talk about the accessibility features of the webinar. We already provided you with information and links in the emails beforehand. In case you missed some links, please have a look in the chat box. You can find more links there as well on the right of your screen. As you can see next to my camera in the top of your screen, the webinar is interpreted by international sign language interpreters. If you cannot see them, please click the button View All in the top center of your screen, as displayed in the two pictures on the slide. You can change the size of the camera with a click on the bold line separating the video image from the presentation and drag it down and up. Additionally, we provide live captioning in an external window today. To access this, please click the link in the chat box or type in the address displayed on the presentation. Lastly, and maybe you have noticed already, I'm saying next slide every time we change the slide for those who follow the webinar using a screen reader software. Next slide. Before talking about troubleshooting, please note that the webinar is recorded today and we will share it with you afterwards. Now, if your computer audio is not working or you experience connection problems, you can also listen in with your telephone. You can find the numbers in the registration email and on the top right of the control panel. Last but not least, if you are unable to solve any connection problems, please write us in the chat box or email us to the email address leavenonebehind@deutschland.hi.org. Next slide. Let's have a brief look at the navigation features of the app. You can find the control panel on the top right of your screen. It looks like the pictures displayed on the slide, and with the orange arrow on the top left, you can collapse and open it again. To change the language setting of the app, click on the world symbol that looks like a small football in the top center of the control panel. Next slide. And now to questions. Because of so many participants that are joining us today, we can unfortunately not accept verbal questions. All participants are therefore muted at all times and your cameras are turned off, but we encourage you to submit your questions by typing them in the question box below on the right and click then the send button. We will receive them and try to answer them in the question and answer session later on. The picture on the slide of the presentation shows you where you can find the box. You can also access the chat box by using the keyboard shortcut Ctrl-Alt and T. And if you experience any difficulties to enter any question there, please email us the question again to the email address leavenonebehind@deutschland.hi.org. Now, before introducing, next slide. Now, before introducing the speakers to you, let's have a brief look at today's agenda and the objectives. So after this short introduction, the main presentation will take about 55 minutes today. We will have a 2-minute sensory break after roughly half of the webinar, to give you the chance to unwind and relax. The main part is followed then by a question and answer session of about 20 minutes today. And here the speakers will answer the questions from the question box you submitted during the webinar. And the session is moderated by Sabrina. In the last 5 minutes, we will wrap up, and at the end, you will be directed to an evaluation form. Next slide. Now, what are our objectives for today? During this session, the speakers will present key barriers and risks for persons with disabilities in the humanitarian COVID-19 response. What factors may put them at heightened risk? What barriers aggravated those risks? Along 4 key considerations, the speakers will provide key actions, promising practices, and practical recommendations to ensure safe and inclusive access to the response. And lastly, we will touch on key resources you can use in your programs and projects. Next slides. Now, finally, I'm honored to introduce today's wonderful speakers. For that, I would like all speakers to open their cameras shortly so we can see you. The cameras will be closed afterwards again for the presentation. All right, the cameras are open slowly. Now, let me start. First, please welcome with me Sien Andries. Sien is our main speaker today and will guide you through the session. She works as Inclusive Humanitarian Action Specialist for Humanity and Inclusion in France and has extensive experience working on inclusion of persons with disabilities in humanitarian action, having worked both at headquarters and in various humanitarian settings. She also participated in the development of the guidelines on inclusion of persons with disabilities in humanitarian action. Welcome, Sien. Next, Paul Mugambi joins us from Kenya today. Paul is a disability rights activist and worked in both development and humanitarian assistance for many years. He describes himself as passionate to see a more inclusive and empowered society and works in Somalia as an inclusion technical advisor for humanity and inclusion. Further from Somalia, as a backup speaker, we have Ulrike Last, country manager for Humanity and Inclusion Somalia, and joins us in the background. Thanks both of you for joining us today. Next, we have Cucu Saida, joins us from Indonesia. She has a strong background from the disability movement in Indonesia and in the network of organizations of persons with disabilities there. Currently, Cucu is working as disability inclusion advisor for CBM Indonesia and supports them in ensuring inclusion within programs, staff, partners, governments, and mainstream actors. Welcome, Cucu. Further, Mariana Martinez joins us from Sierra Leone. Mariana has been working in the disability field for 15 years now and with Humanity and Inclusion as inclusion technical specialist in Sierra Leone since about a year. Before that, she worked as an inclusion coordinator at a local organization running community programs in Malaysia. Great to have you with us today too, Mariana. And last but not least, Juan Angel de Gouveia Fernandez joins us from Venezuela. Juan Angel is the president of the Venezuelan Confederation of the Deaf, Consorven. Additionally, he is a member of the board of directors of the World Federation of the Deaf and of the International Disability Alliance. And among the many things and positions Juan Angel held in his life, he has been the vice president of the Latin American and Caribbean Network of People with Disabilities and Their Families since 2017. And yeah, joins us today. Thank you very much, Juan Angel. Now, with no further delay, I would like to give the microphone to Sien. The floor is all yours, Sien.
Thank you, Hakon. Thank you, Hakon, for the introduction. Just checking if you can hear me. Yes. So thank you all for joining today from different countries and different time zones. So I'm really excited to be here with you as well. So as introduced by Hakon, the objective of today is really to give the floor to different speakers to focus on what humanitarian action actors can do to ensure inclusion of persons with disabilities as part of crisis-affected communities within the COVID response. So we will be particularly focusing on contexts that are already fragile or existing humanitarian contexts. So why is this important today? Next slide. So today we acknowledge already, and we have read that persons with disabilities represent a vast group among any affected community. So as represented in the infographic, you can see that at least 15% of any given community are persons with disabilities, and higher prevalence rates might occur among women, but as well among older persons that are already all more affected by COVID. So we can see that half of the population above 60 years old has a disability. So additionally, we expect as well higher prevalence rates within humanitarian settings. So we have seen that recent assessments, for example, in Syria, showed up to 30% prevalence rates, as well as additional barriers and risks in accessing humanitarian assistance and protection. So evidence shows already the negative impact of health emergencies on persons with disabilities, as well within the COVID response because of the discrimination they have been facing. Yet there is limited data and evidence available within the context affected by crisis. So we know as well that today there's different policy commitments made by various humanitarian actors. Yet we see as well within the COVID response that the humanitarian services are not yet sufficiently inclusive. So disability inclusion is still often seen as something that can happen later on, that can be deprioritized, let's say, or something that shouldn't require sufficient funding. So often we see funding gaps, but as well the lack of skilled staff that have the right attitudes to accommodate the needs of persons with disabilities. So first of all, I would suggest us to pause quickly on the concept of disability, and I will be handing over to Paul for this. So Paul, can I ask you to introduce quickly your understanding of disability? Next slide.
Thank you very much. My understanding of concept of disability is all about how it has evolved from time, from the charity mode of from charity to medical model, and now to the right-based approach, whereby we are able to understand persons' abilities, are men, women who are from different backgrounds, age, and also in terms of persons who are having pre-existing condition, and also we are also able to understand through these different, they are exposed to different barriers, which include environmental, and these barriers might be intended or not intended, and these barriers are basically institutional, which are like when you look on the discriminatory policies, issues regarding attitudinal, which range in terms of the attitudes and communication barriers which they face. And with the right-based approach, whereby you are using the UNCRPD as our definition of disability, we understand it's a evolving concept, and it's all about how persons with impairments interact with the barriers, and we are able to understand that through these persons with the different impairment, that is physical, persons with hearing impairment, intellectual impairment, visual impairment, and psychosocial, which interact with the environment, which are then make issues of inaccessibility not to be achieved, or we experience different social barriers which surround persons' abilities, and we need to look in terms of how we can enhance the society, which in different contexts. For example, when you talk about the convict experience, we find that there are different barriers which persons' abilities face, like the way the environmental barriers in terms of the physical access of the, let's say, for example, the hand washing stations, which are not accessible for persons' abilities. And through this, we are able to understand that not all persons' abilities are vulnerable. We need to understand that concept of how risks, or how by persons' abilities are experiencing those risks. And most of the time, we find as humanitarian actors, we need to look in terms of how the barriers are affecting persons with different impairments. And through this, we are able to determine how we can address these barriers in different ways. We need to also understand that through these different experiences, persons' abilities, not all of them are vulnerable in terms of accessing different activities.
Thank you, Paul, for that. So next slide. So building a bit further on what Paul has introduced, so I want to highlight that persons with disabilities might be exposed to multiple risks. So we have an infographic nicely showing that multiple risks might exist within the COVID response, like increased health risks, socioeconomic vulnerability, or for example, food insecurity, which occur due to a combination of structural inequalities, but as well crisis-specific inequalities and discrimination, like Paul was explaining. So what are those risks, particularly within the COVID situation? So first of all, there's an increased risk of contracting the virus. There's as well an increased risk of experiencing complications, and as well having more difficulties to cope with the situation. So when we look to more particularly the exposure risk, we might know that persons with disabilities might be more exposed to being reliant on assistance for daily tasks, having to manipulate the environment, but as well assistive devices for communication or moving around, such as orientation, or having difficulties in practicing the physical distancing. In terms of the underlying health issues, we might know that persons with disabilities are more susceptible of contracting the virus, but as well experiencing severe complications. This, for example, because of respiratory problems or problems with the immune system. That then often goes into combination with numerous barriers, like introduced before, that can be physical, attitudinal, institutional, but as well communication barriers within the preparedness and the response mechanisms to COVID. Just to point out a few examples, like preparedness plans that might not be sufficiently inclusive and support persons with disabilities to prepare for quarantine or hospitalization, or even lose their livelihood opportunities. It can be about public health and protective messages that are not sufficiently accessible, like, for example, not be available in multiple formats or simply not reach them, or, for example, the hand washing stations being too far away and inaccessible. Often we see on top of that that healthcare staff might be discriminatory and even deny access to services for persons with disabilities. So these are then added on to pre-existing inequalities, such as higher rates of violence among persons with disabilities, lower access rates to quality health services, but as well lower formal and informal education access, which could then further lead to reduced access of information. So additional impacts might already be seen and have been communicated before because of collapse as well of social support systems, such as the collapse of home-based assistance due to public restriction plans, or community support systems, such as, for example, accessing food distributions. So next slide. I want to quickly highlight to you as well that multiple risks, they can add on to each other, what we call intersectionality. So, for example, persons with disabilities living in poor and overcrowded settings, they might face multiple access barriers to services, such as health services, but as well difficulties to practice physical distancing. Another example might be women and girls with disabilities who might be more exposed to risks of domestic violence, or, for example, violence by armed forces due to the collapse of the protection systems in the current COVID situation. Important to highlight as well, as mentioned before, is that we saw the definition of disability and persons having different types of impairments. So we don't solely speak about persons with physical impairments and those, for example, caused by war injuries, but we speak about persons with different types of impairments that face different types of risks. So looking, for example, to persons with intellectual impairments, they might be more challenged to adapt to the situation if we don't adapt our learning methods when providing them information, or be at higher risk in case of separation of a support person, while persons with sensory impairments, such as difficulties hearing, seeing, and speaking, they might face difficulties rather in accessing public health information. You might have heard about actually the man in Uganda who got injured by civil protection forces, actually because he was not informed about the public restriction plans, in particularly the curfew, and civil protection wasn't able to communicate with him and address him. So to go a bit more into those contextual barriers and risks, I will be handing over now to Chuchu. So Chuchu, if you can provide us some highlights on the impact of COVID on persons with disabilities in Indonesia and how different actors can overcome those. The floor is to you. Next slide.
Okay, thank you, Sian. So everyone, I would like thank you so much for joining us today. I would like to share with you the experience from Indonesia in response to COVID. So in Indonesia, there are the network between the network on disability movement is increasingly stronger, where especially in the response COVID, they're more even stronger because lots of them engaging disability leaders and organization of persons with disabilities in the response. So one of the initiatives that Organization of Persons with Disabilities Network has been done is that the survey that we conducted within 2 weeks, the online survey, to measure or to know about the COVID impact to persons with disabilities by having the data disaggregated by gender and age. Also, this would like to know or to measure about what are the impact to socioeconomic and education as well. Another advocacy initiatives of the Organization of Persons with Disabilities Network is that by joining with different forums of response COVID that are happening in Indonesia. So from those survey and advocacy, there are like 3 highlighted findings regarding barriers and risk. For example, the first is about institutional barrier. In this case, persons with disabilities, especially those who has psychosocial disabilities and multiple disabilities living in institutions, are especially at risk as they have not been forgotten by the government response. The second barrier is about the communication barrier, where information barriers prevent persons with disabilities from accessing information on COVID. Currently, the government of Indonesia, they have set up the contact center for COVID, but those contact centers are not accessible yet. The third barriers that we found from the survey and advocacy is that institutional barriers plus attitudinal barriers. Here that we are talking that health actors lack awareness on inclusion that is causing persons with disability to be excluded from health services, both for seeking assessment and treatment for COVID, but also pre-existing conditions. From those 3 barriers, there are, I'd like to say about 2 examples that was happening in Indonesia regarding the COVID, just to practically illustrate. The example first, when we talk about the institutional barriers, it was happened to the 3 children with multiple impairments who were living in an institution were infected with COVID. Their caregiver tried to bring them to the hospital, but the medical staff rejected them as they were not able to take care of themselves independently. Here, it would also be good to tie in about attitudinal barriers and how this impacts access to services. The second examples that we found from the network or from the advocacy network is that communication and attitudinal barriers. Last week, we had a case. There was a person who was deaf and had COVID symptoms and went to the hospital, but the staff did not know how to communicate with him. This one is also really explaining how is the communication barriers. But the good thing, we do have a strong network with volunteers. And then we ask our network to connect it with the hospital and then give the assistance to the hospital to make sure that this person get an access in the communication. So from those findings and the findings of barriers and risks, I'd like to highlight the main recommendations from the work done in Indonesia so far. The first recommendation is that the importance of engaging with the disability movement. In Indonesia, the Organization of Persons with Disabilities Network has been engaged with raising awareness and sensitizing governments and humanitarian actors. And of course, it is important for Organization of Persons with Disabilities to be involved in different cluster meetings, and humanitarian actors have a role to play in encouraging and facilitating Organization of Persons with Disabilities participation in forums and clusters. So from this, with this example, what we are doing is to really providing to ensure that sign language interpreter are available for every time the government, especially the Ministry of Health, had or giving the press conference in the television, and also asking to the clusters and forums of humanitarian actors to provide sign language interpreters, ensuring of that. And then currently, but working by the Organization of Persons with Disabilities, we are trying to have like closed caption for the session learning. So the second recommendation I would like to highlight is the local context, because in Indonesia is a Indonesia is diversity, our diverse country. It is important to work based on local context, especially at the village level, and engage with the local government. And in this case, of course, the village government is the first thing to really engage with. So the third recommendation is about information and communication to be accessible. It's really need to consider not only providing the information or accessible information, but also think about how we really think about how to deliver and target the recipient of the information. Because sometimes we found that there are quite easy to understand materials or information, but in terms of delivery, it's still in question because it's currently mostly based on internet, like through social media. But think about how to reach those people with disabilities that are living without internet connection. So those are the main recommendations. And then lastly, the example, we are in the early discussion actually within the disability movement. how to deliver this message or how to deliver the accessible information is information and communications, which ties in importance of engaging with the disability movement and ensuring messages are appropriate for the local context. So what we are thinking or discussing at the early phase right now is the mobile public announcement to raise awareness and provide information on how to prevent spread of COVID in some areas are being delivered by loudspeaker through village car or local ambulance. So we can use that vehicle. The disability movement has now been engaged in this initiative to discuss solution or on how to utilize the mechanism of delivering it to be more accessible, including in more local language, and also screen on car to display video message. Thank you, Xian.
Thank you, Chushu. This was really interesting. And yeah, thanks for highlighting those barriers and recommendations, because it shows us very much the need to work on multiple actions to ensure disability inclusion. So next slide. I wanted to highlight quickly, to arrive to disability inclusion, we need to allow us using a twin track, or what we call a two-pronged approach. So on one hand, identifying and removing gaps across all steps of the program cycle, which is mainstreaming disability inclusion within our humanitarian action, but as well having dedicated actions to respond to the needs of persons with disabilities and to ensure their meaningful participation and engagement, like Chuchu briefly introduced before. So it's really the responsibility of different actors, which involve health actors, but as well non-health actors at the national and a local level, with the government being the primary stakeholders. So they need to work according to relevant legal frameworks, which include the international humanitarian law, but as well respecting, for example, the refugee law or the Convention of Rights of Persons with Disabilities. Next slide. So today we will be running a bit more through different key considerations, which are applicable to all sectors and all phases of intervention. So it's not an exhaustive list, but we will be going into presenting the gaps in those 4 different domains, highlight some key recommendations and takeaways, and then give the floor again to different speakers to introduce practical examples. So those key considerations include the collection of data on persons with disabilities, so meaningful participation of persons with disabilities. The third one, inclusive communication and information sharing. And the fourth one, engaging with persons with disabilities and their families to ensure their protection and their health. So to go on to the first key consideration, next slide. I want to briefly highlight the importance of data on persons with disabilities, like the assessment introduced by Chuchu before. So today we see that still limited data is available on the impact of persons on persons with disabilities and their access to COVID health and non-health responses. When we look, for example, at the Global Humanitarian Response Plan, it does not really mention the needs of persons with disabilities, while we know that very few actors as well, they monitor access rates of persons with disabilities, for example, to hand washing stations or health units. So within humanitarian assessments, we see as well the risk that persons with disabilities are often chunked together, like being considered as one homogeneous group with similar needs, which of course makes it difficult to adapt humanitarian responses afterwards. While there's limited evidence available as well on additional violence and stigma persons with disabilities might face within this COVID situation, such as the negative association of persons with disabilities with COVID. Next slide. So what can I recommend already to you? So it's really about identifying needs and risks of persons with disabilities by collecting as much as possible disaggregated data. So for example, when we conduct CAP surveys or multi-sectorial assessments, we could use the Washington group, which you might know already, to allow disaggregation of our data by disability. So this is really to look in a non-discriminatory manner and a simple manner to collection of data on persons with disabilities. We should reach out as well and engage with persons with different types of disabilities during assessment and monitoring. So both active at national and local levels, representing different types of disabilities, and as well men and women, boys and girls, of course. So we should identify and keep monitoring discriminatory practices and protection risks, such as, for example, discriminatory attitudes and health units, or as well the denial of access to service or particular violence against certain groups that might occur. So below we are sharing a link where you can find more information and learn more about collection of data on persons with disabilities. So I will go on to the second key consideration now. So we wanted to highlight quickly the importance of meaningful participation. So often we see as well that persons with disabilities are solely seen as receivers of aid. Well, actually persons with disabilities play a very important role and should be engaged in humanitarian decision making and to ensure the humanitarian response is inclusive of them. So for a practical example on meaningful participation, I will be now handing over to Juan Angel. So Juan Angel, could you take a bit of time to explain us how you are working as an organization of persons with disabilities in Venezuela to influence the humanitarian response? Juan Angel, over to you, and next slides.
Okay, good morning, and thank you for having me here. Thank you for the opportunity this afternoon, this morning here in Latin America. I'm from Consorven, it's the National Federation of Deaf People here in Venezuela. We are working with 59 organizations with people with disabilities. We are advocating for the humanitarian action for human rights for the people with disabilities. And this time I'm going to talk about the COVID situation here in Venezuela since March the 13th, since government has taken some measures of social distancing, the lockdown here in Venezuela. Consorven has started a work, not starting at this moment, is starting a work from the COVID situation, because we have been working with people with disabilities since a very years. So we work with some with human coordination platforms clusters to aim of promote inclusion of persons with disabilities, engaging in the COVID situation to give them the information, to give the people with disabilities the information so they can be engaged in this situation, and to collect the data, to collect the information, to get to know about the situation of the people with disabilities in every accessibility format, in easy reading, sign language, braille, and etc. Where our aim is to promote production of materials and tools for the inclusion of persons with disabilities and promoting access in services implemented by mainstream organizations. But in order to work with these cluster sections, we need to get to know what is the need of the people with disabilities. In 2019, we were working as humanitarian actors with other humanitarian actors, and in order to have to get to know the people with disabilities in each state of Venezuela, in each municipality, and how are they doing, how are they going, and what is their necessities in this time. So in order to have the OPDs to do the advocacy against the government, and how to make a meaningful participation. Next slide, please. Okay. How to make this meaningful participation? The first we need to do is to get to know what are the barriers that people with disabilities are confronting. For example, we're identifying the barriers of accessibility to service of persons with disabilities, and communicating with each organization of people with disabilities, if in order to getting to know if they have subtitles, if they have sign language interpreting, or if they have information in accessibility formats. So we have a recommendation of communication, easily communication, access to information. So in this way, people with disabilities can be involved in humanitarian action taken by an organization or the government, leaving no one behind in the access of information. So looking for this goal, we work with clusters of services or similar clusters to make the elaboration and presentation of assessments of evaluation on barriers faced by people with disabilities. So the clusters can recognize the barriers that people with disability faced. And the second is the production of presentation of practical inclusions. The meaningful participation can be direct and active participation of the organization of people with disabilities in three key activities: awareness raising sessions for humanitarian actions, through clusters on disability and inclusion humanitarian actions. An emphasis is placed of twin track approach, sending key messages to humanitarian actions on the importance of including people with disabilities to make the response inclusive in each phase of response. So people, in this way, people have the practice, have the engage in all the sectors, all the clusters, and what is the meaning for people with disabilities. So we need to teach the people with disabilities about these clusters, about their necessities, about everything that can aware this humanitarian actions in all of the sectors, training and technical support. Next, please. Okay. We were working in a network work. We can name this network work. We just want to identify networks at national or local level to amplify their actions. Listen and learn about their experiences and similar situation, and how to overcome these barriers. How do they overcome these barriers? Through information, and collaborate on interventions through this training and technical support in this aim. And collaborate on interventions to ensure non-discrimination, increase understanding of communities about persons with disabilities and their needs, make information accessibility and diverse, challenge misconceptions, etc. So we can resume this in the phrase that we all know, that leave no one behind. So we need to work with OPDs, clusters, the government, so in order to have the responsibility of each sector, each community, or each cluster, to work together to eliminate this kind of barriers.
Thank you, Juan. This is extremely interesting. I quickly wanted to highlight to the different actors here on the call that it's really important to engage with persons with disabilities in preparedness and response planning. So during the assessments, but as well the design of activities, and for example, in developing inclusive communication materials. It's really interesting to learn from their experiences in similar situations, or how they can or suggest to overcome barriers they might experience. So this by directly collaborating as well on interventions, such as, for example, conducting community sensitization sessions or having joint advocacy efforts towards the clusters or towards local stakeholders. Now, I want to give back the floor a few minutes to Paul to briefly explain how we are promoting participation of persons with disabilities in the context of Somalia. Paul, are you still with us? Could you give a small intervention on participation?
There are some processes which we are undertaking as a humanity and inclusion in order to ensure participation of persons with disabilities in the process. These processes include in terms of ensuring that we are able to engage them in terms of participation, whereby we are enabling them to participate in terms of development of the disability inclusive tip sheets, and also sectorial, whereby we want them to ensure that we consult them, we engage them in terms of production of messages. For example, since we find that in this era, there is a low face-to-face conversation, so we are led to practice online or phone conversation with the OPDs, and we are able to engage them in terms of how they are able to develop the specific tip sheets, engaging with their contacts so that we can link them with other humanitarian service providers so that they can also promote participation. And also we are enabling the walking the talk in terms of engaging actors so that they can able to reach out to persons with abilities in terms of how they are collecting information, and also engaging clusters to ensure that when they participate, they consult persons with abilities, and also when they are having these barriers in terms of the washing facilities, they are able to engage, to consult persons with abilities directly, and enable them in terms of actualizing collection, identification of the barriers which persons with abilities experience. We also, through the organizations for persons with abilities, they are able to give highlights or develop messages which are being broadcasted by having press briefing. Like we have one of the organization called Somali Disability Network, which frequently highlights issues, and also in terms of giving evidence of what persons with disabilities are experiencing. And this one also enables them to participate in the community. So through this, they are able to help identification of barriers. They are also able to collect data and help the humanitarian actions, which we are helping them to build their capacities. And this information also assists the clusters or even the sectors.
Thank you, Paul, for that. As we might have heard by our different speakers, persons with disabilities often miss out on crucial information to the lack of accessibility and diversity of messages, which counts equally as well for persons often who are illiterate, older persons, or younger children. Some examples were provided on announcements that might not be subtitled, or written information that actually is not in accessible formats, or information that doesn't sufficiently reach out to remote areas, those who don't have radio, phone, or those who are, for example, confined in prisons or in institutions. We see as well within the current COVID response that a lot of the materials that are produced are actually depicting persons with disabilities wrongly, which can actually enhance discrimination and sometimes prejudices against them. So, for example, representing persons with disabilities as persons who are sick, persons who are suffering and need help, which is going the opposite way of inclusion of persons with disabilities, of course. So I want now to give the floor to Mariana, so to quickly introduce how you have been working in Sierra Leone to ensure that the COVID messages reach persons with different types of impairments. So Mariana, the floor is yours. Next slide.
Yes, thank you for having me here. Oh wait, yes. So we've been doing different things in Sierra Leone, and we've had some direct interventions and some indirect interventions. So in terms of our direct interventions, we have a very strong network of community-based volunteers for our different projects. So right now what we're doing is we're capitalizing on that network because those volunteers are people in the communities. So through them, we are able to follow up and monitor our beneficiaries, making sure that that they're okay, that they're receiving the messages, and that they're able to follow, for example, the radio lessons. Another thing that we are doing is working closely with the different OPDs to make sure that we are reaching as many people with disabilities as possible. These OPDs have representation in all the different districts, so that way we can reach them because of the movement restrictions. And then the other thing that we're doing as direct intervention is working with authorities, especially the office, the emergency office and the city council, to train them in how to have inclusive responses. In terms of indirect interventions, basically what we're having is we're just being part of all the coordinating pillars, or as many as possible. And through these pillars, then we are able to advocate and to promote inclusion from the use of different formats for the messages, the use of different local languages, the use of sign language interpreters, and also reviewing the materials that we'll be disseminating to make sure that they are accessible. Next slide, please. So in this slide, we just see an example. Now the emergency office is using a sign language interpreter for their daily morning briefings, which of course for us it's a huge step forward. Next slide, please. And lastly, a few recommendations on what other actors can do. So the first one would be to consider enhancing the participation or collaboration of OPDs and people with disabilities. So try to engage them and promote their participation. Another thing that any other organization can do is to make sure that inclusion is taken into consideration in your preparedness plans and your emergency response plans. Another thing is to advocate. So in any network or coordination meeting, just raise the issue of inclusion and accessibility. Always pose the question. So what are we doing for vulnerable populations? What are we doing specifically for people with different disabilities, to make sure that it's taken into account? And the last recommendation as well, which all of these have been mentioned by previous panelists, but is to make sure that your communications are presented in different formats to reach the different people. And that is it. for my side. I will be available at the end for any questions.
Thank you, Mariana, for that. Thank you very much. This was really interesting. So which brings me quickly to jump over the next slides, which is actually summarizing some of the recommendations we heard by the many different speakers on accessibility of information, as well on challenging some of the stereotypes we might see within the different communication materials. So last but not least, we have touched upon it briefly. Next slides. I quickly wanted to highlight some messages on actually protection and health of persons with disabilities and their families. So next slide. So in order to ensure health and protection of persons with disabilities, we just wanted to pinpoint quickly, and we will share different materials and messages afterwards, that it's really important to collaborate with different actors, working at local and national levels to reach out to persons with disabilities and their families. This to ensure they receive the protective messaging, such as the two infographics provided on the right-hand side by WHO, the World Health Organization, and sharing information on how to apply public restriction plans, how to access services, but as well how to stay healthy and safe. This could be, for example, information on how to prepare for public restrictions and isolation, such as preparing food, medication, or maintaining support systems. And for this, we wanted to highlight as well that it's really important for the different actors to adapt their interventions to fit the different needs of the communities that are in front of us. So, for example, considering to provide additional protective equipment, soap, water, or a protection screen to households of persons with disabilities, or considering cash interventions to allow their critical health or protection referrals. So finally, before going to some of the questions you might have, next slide, I wanted to provide some overall recommendations and point out some resources which can actually help you in starting off on an inclusive humanitarian response. So I will ask you to skip a few slides as we have been shuffling around to different speakers. Apologies for that. So on the final slide, you see a few resources you can start using. So the slide is called resources. So we advise you to have a look at the global guidance on disability inclusion within the COVID response, including guidance from the World Health Organization, UNICEF, as well as International Disability Alliance. There's upcoming messages that derive from the ISC guidelines, the Interagency Standing Committee guidelines on inclusion of persons with disabilities in humanitarian action, which are very helpful. And there is as well different hands-on tools that will be shared after the webinar, for example, on inclusive communication. So now I will be passing on to Sabrina to see if you have any questions for the different panelists. So thank you all for listening in again.
Yes, thank you, Seem. So we have about 10 to 12 minutes left for questions to leave Hakan the word for the wrap up. So we received quite many interesting questions, and I would actually like to start with one to you, Seem, as you were kind of guiding us through the whole presentation. And one thing we didn't really touched upon was organizations who face HR restrictions. So the question was what to do if humanitarian actors have many competing priorities, so facing, for example, HR restrictions or supplies shortages or movement restrictions or even funding. So what does that mean practically. So do you have maybe any success stories you can share where persons with disabilities could be included, even though there were many other competing priorities?
Yes, thank you, Sabrina. And yeah, thanks for the question. This is really interesting, and it's actually a story we hear in many different countries. On the one hand, because COVID not being in all countries as well experienced as being the most urgent needs. So I would say it's really, Paul, can I just ask you to use your microphone? Thank you. I would say it's very context specific, actually, the answer, and it really depends on analysis of the context and the needs. So the first thing that would be strongly needed is analyzing urgent protection needs of persons with disabilities, so risks of dying, severe and targeted violence, among other protection needs, and then seeing how those urgent needs can actually be added on to ongoing programming where basic needs are supported. So I will leave it here.
Okay, thank you, Seem. Thanks very much. So another question that was posted was about barriers for persons with intellectual impairments. So Paul, as you've just had your microphone on, can I ask you to turn it on again, because I would like to pose that question to you. If you could remind us of barriers that affect persons with intellectual impairments, and could you slightly touch upon efforts from civil societies? So how can we reach out to organizations of persons with disabilities? What were their efforts, and what happens if you're working in a country or context where you don't have any organizations of persons with disabilities or civil society support? Thank you.
Thank you very much. First to note is that persons with intellectual impairment are one of the marginalized categories of persons with disabilities, and in most cases they are not involved or in the processes or in the humanitarian action. One of the challenges they face is in terms of communication. Like, for example, when you're talking about risk communication, which is currently going on in terms of COVID, when materials are not produced in easy or plain format, alternative format, it becomes so difficult for them to access such information. One of the ways which we are encouraging organizations of persons with disabilities and also sector or the clusters or even most of the humanitarian actors is to ensure they consult persons with disabilities and the caregivers so that they can be able to also communicate to them directly and also try to engage them in terms of the service delivery. If they are having like the sector leaders, like let's say community leaders, the religious leaders, the organizations of persons with disabilities, they are also able to reach out to the persons with disabilities directly through the interventions which they are offering. Just the mere consultation of the affected population makes them, or persons with intellectual impairment and also persons with psychosocial impairment who are largely marginalized or they are not involved in terms of the sector interventions.
Okay, thanks a lot, Paul, for this. Yes, we can. So thanks a lot for that comprehensive response. So my next question, or actually not mine, but one of the participants was very keen and interested in the input from Tutu. So Tutu, this question is for you. So you said that you used multiple communication channels for your information, and the question was if any of this is documented. So if, for example, using screens on cars with video messages, is that documented somewhere? Are there videos where this experience is shown? So any good practices, maybe that could be of use also to the colleagues who would then recycle or adapt their work accordingly. Over to you, Tutu.
Thank you, Sabrina. I think with this, the idea of having screens on car, it's not practiced yet, but it came up from our discussion during our advocacy, as part of our advocacy. This raised and then now in still very early discussion, because our concern about the availability of the information and communication materials, but the most concern is how to get or to reach people who don't have internet based. So the idea of having screen on the car, usually like local community car, it will be one of the option to deliver the message or information. It's because then in terms of reach out, it will be even broader, not only specifically to people with disabilities, but to the whole communities. And also, this idea came up because that we had the discussion. For example, talking about the printed out materials, let's say Braille information, let's say information in Braille. Our concern is there whether it's taking even the risk or exposing people who are blind to the risk, because it has touched the surface and we don't know during the production whether it's clean or not from the virus. So that was all those concerns, and then we came up with this idea. But again, this is really in the very beginning of the discussion with the disability movement. So hopefully this will be implemented at least in a few of village. So we should work together. I mean, here in Indonesia, not only organization of persons with disabilities, but also how to really strengthen the engagement with the local village. In this case, is because they are the local authorities, and also support from other humanitarian actors such as other clusters. This really important, and then make this happen actually. Thank you.
Yeah, thank you, Tutu. So my last question, and that actually goes into the same direction as what Tutu was saying just now about reaching remote areas. So Mariana, may I ask you, so the question was if you could elaborate a bit more on outreach activities to rural and remote areas. So above all, in contexts where there are, for example, movement restrictions. So we've heard of internet problems now, but in some contexts we might have also movement restrictions. So how is it possible to access the local community? Which communication channels do you use, and maybe how do you adapt the messages? Thank you.
Yes. So here in Sierra Leone, for example, right now we have movement restrictions inter-district, so we cannot move from one district to another, as an example. So what we have been doing is working, as I was saying, with the OPDs, because they have representations of different OPDs in the different districts. So by working in a coordinated approach, we can make sure that we're reaching all the districts, and then those OPDs within their districts, they try to coordinate with the different communities. So that's the way that anyone can engage with the different OPDs. Now, also specifically because we had already this network that I was mentioning of volunteers in the communities, it has made our work easier, because then it's through them that we can really monitor, even in communities where there's no internet connection and so on. So we can reach through them. Usually they manage to have some sort of working phone, and we can establish communication by that and understanding what are their needs, and then seeing how we can respond to those identified needs.
Okay, thank you, Mariana. Yeah, no, it does. Thanks a lot. And actually, I would leave it here with that last question, and would hand over to Håkon to wrap up our first webinar. So yeah, over to you.
Thank you, Sabrina. And thanks to all the speakers and participants for this great session. That was really interesting. And it went very well, even with the connection. So thank you all. Now we are nearing the end of the webinar. But before we finish, I would like to say a few closing reflections, but without repeating the speakers. So I'm going now on the slide closing reflections. The inputs of today, they showed that it is essential that humanitarian actors adopt a human rights-based approach to disability in the COVID-19 response. Persons with disabilities need to be placed at the center of the response, but as active agents throughout the whole program and project cycle. Today, we listened to 4 key considerations in the response and various practical recommendations. Now it is imperative that all stakeholders take those necessary steps and key actions. So now it is up to you guys. We would like you to leave today's webinar by reflecting on existing processes in your organization. Identify entry points to achieve quick wins in the beginning and start from there to gradually build a more systematic change. But before you leave now, so before you leave the webinar, just a few words on the next steps after we finish today. Next slide. After the webinar closed, you will be automatically directed to a short evaluation of the webinar. And we really encourage you to take that short evaluation because it will help us to improve and to incorporate your feedback for our other trainings. Please take we will send you a follow-up email beginning of next week. And we will include in the follow-up email a link to the recording of today's webinar. So you can listen to it again, but you can share, and we encourage you to share the recording as well with your partners inside your organization, with your stakeholders. Then we will add the presentation as well. So you can go through the presentation again. We will add additional useful resources with links, so you can click through that and apply them. And we will answer to those questions that we had no time answering today in the question and answering session. Last but not least, I would like to remind all those of you who are working with a German-based humanitarian actor that the joint project Leave No One Behind by HI, CBM, and the Ruhr-University Bochum, and which is funded by the German Federal Foreign Office, is also offering technical support to mainstream disability in your organization and programs. If you're interested, please contact us through our email address, which is displayed here again, and you will find in your emails too. So next slide and last, once again, I would like to thank all speakers today for their great inputs, with a special thanks to Scene for guiding us through the whole webinar. Further, our thanks goes to the interpreters Oliver and Christopher from Overseas Interpreting, Kelly from Caption First, who was doing the live captioning today, and Fernando Barbosa for the Venezuelan Sign Language interpretation today. And last but definitely not least, I would like to thank all of the colleagues that worked tirelessly the last weeks in the background to prepare and organize this webinar. It was a truly amazing experience. And thank you all. Thank you for joining us. Stay safe and have a great day, and goodbye.